Welcome, everyone. Glad to have you all back here with Wellness Wednesdays. I'm Carla Coleman, your host, Director of Communications for New Salem Baptist Church in Columbus, Ohio. And just come on into the chat. You know the drill. Put in your questions, start to say hello to everyone, and then we're going to get started very soon. Today, we're going to talk about dental hygiene wellness. I know we talk about wellness in many, many different ways, and oftentimes, a lot of us don't really think of how your teeth and your mouth can affect your entire body. And we have with us today Gail Taylor, who is a enhanced licensed dental assistant, and she's going to explain all that shortly. But she's got some great information to share with us when we talk about prevention. We were talk about when we have some pain in the mouth, when we talk about all the things related to our dental health. So welcome, Gail. Glad to have you with us tonight.
Thank you so much. I'm glad you invited me. I was waiting on
Oh,
dentistry.
great. Wonderful. Well,
Talk about it.
I'm looking around your room around you, and you have just about all the greatest things to demonstrate what you're going to talk about today. So I'm so excited for that. This makes it a lot different than usual. So I love the effort that you put into sharing with us your knowledge. So
Well,
tell
thank
us a little bit about yourself and
Yes.
what you've done, etc., and your passion.
Oh, thank you. I am Gail Taylor. I have worked in dentistry for 30 years. I am newly retired for 4 years now. I worked in Worthington for 26 years and 6.5 years actually for a dentist in Fairborn, Ohio. Um, and that's the only two jobs I've had other than college um, and living in Kentucky. So dentistry is my passion. My boss calls me about every week to come back. I think he would take me back in a heartbeat, and we are great friends. So we worked together for a long time. He knows how much I love dentistry. Again, like I said, dentistry is my passion. So I do have a lot to cover tonight. So you need to kind of get
Great.
right to it. Yes.
Absolutely. Well, before you get to it, Gail, why don't
Yes.
you explain when you say enhanced licensed dental assistant? Explain
Right.
that to the audience tonight.
We are licensed by the state of Ohio, but actually we are licensed in 14 states. We have to sit and
Hmm.
take a boards test. We go to school, we learn everything that the dentist learns on how to restore teeth. So if you come in the office and you break a tooth, we can actually restore and build that tooth back. And of course, the
Mm.
dentist is on site, but we can actually fix the tooth as well. We can do everything to the tooth but numb it. Now, hygienists can numb a tooth now. Uh, we just can't numb it yet. We also
Mhm.
can polish and clean kids' teeth, and adults, we can polish their teeth as well. So we'll cover all those good things as we go along, the things I want to show you. So we're ready to
All
get
right.
started.
Well, let's get going.
Okay. So the first thing we're going to cover is brushing techniques. And a lot of people, they put off going to the dentist. The easiest thing that you can do is to come to the dentist and get your teeth cleaned. Now you'll see some little red bumps here along the way, but that's for later on. But I do want to show you the correct way to come in and brush your teeth and at home, while you're at home, to brush your teeth. So the first thing you want to do is buy a soft bristle brush. And the bristles have to be soft, not hard, not medium. It has to be soft. And if it's not soft and you by mistake buy a hard bristle brush, then run it up under hot water until the bristles become soft. What happens is over time, when you continue to brush your teeth and your gums, over and over and over with a hard or medium brush, you wear away tooth enamel. And what happens is you open up the tubules on the side and on the top of the teeth. The teeth become sensitive, then you come to the dentist and you think, oh, I got a toothache. But what we see, you have worn away gum tissue, you've worn away enamel. And so then we have to fill in the spots where you have worn away. Now, we can't replace gum tissue. So we have to send you to the gum specialist, and they have to trim away more gum tissue and to help close in those areas. So you have to have gum surgery. So then, it takes a while for that to even heal itself. So soft bristle brushes, and as you get older, you'll really respect a soft toothbrush. So anyways, what you want to do when you're brushing your teeth, you want to do circular motions, gentle, and come down. And then that's on the upper, gentle motions come down. Lower teeth, gentle, come up. So you want to make sure that if you're on the top surface, you want to do circular motions to get in the grooves and wash away any debris that's in the grooves of the teeth. And men have a hard time getting in the back. So you just have to pull out your cheeks and really scrub and get everything out. On the inside, you want to open wide, get in between here, and tartar builds up down below, and it can form like concrete. So you want to make sure that you're washing away anything that's left in between those teeth. On the outside here on the lower, you want to brush and come up. Oh, I'm sorry, you probably can't see that. Brush and come up and get anything that's left. And work the whole mouth that way. And then
Well, I
after
have a quick question.
Go ahead.
I have a quick question. So what about electronic brush?
You can use
Brushes.
those. We do recommend those, especially for kids, kids with braces as well, adults with braces. They work really well. We recommend everyone brush for 2 minutes. The electric toothbrushes have timers on them, and they do count down. So everybody should be brushing for 2 minutes. It's not about going in there and brushing really quick and I'm done. So it's time to get around 20 teeth for kids, 32 teeth for adults if you have your wisdom teeth. So, but if you don't, those 4 teeth come out, of course, for wisdom teeth. We recommend wisdom teeth come out before you're 20. If they stay in longer than that, then it's hard to get those teeth out of the bone. But we do recommend electric toothbrushes. There's all kind at the stores. We recommend most of them out on the market because they've been ADA approved, and that's American Dental Association. Anything that is ADA approved, it will be on the back, and that's what you should be using. Please, please, please don't use anything on the internet, Instagram, because a lot of times those products aren't ADA approved. So make sure that it is ADA approved. Or ask your dentist and make sure he says, yes, get it. Because if it's not, you're going to have some problems. I know people have often used the charcoal whitening, and they've had some issues with that. So just be careful and make sure things is ADA approved. And again, that's the American Dental Association. So, yeah.
Okay. Great. Well, I'll let you keep going.
Okay, we're going to roll right on. The next thing that you want to do at home is flossing. These are called floss threaders. Kind of see that. And what you want to do with floss threaders, you want to do flossing once a day. But if you get something between your teeth, of course, make sure you have floss or floss threaders. So you want to get in between the teeth. Of course, this is not a real mouth, so it's kind of difficult to get in. But you want to take it in and go in a C shape around the tooth and back up and down, not straight in and out. You want to curve it to a C shape, get down in between the gums, and come out. everything that you eat goes in between the gums, and it stays there, and it will harden if you do not floss down in between your gum tissue. That's what causes gum disease. So you want to make sure that you do floss and take the floss in a C shape around the tooth and remove it every day. Every single day, floss. We recommend that you floss your teeth instead of brush your teeth. So if you get in there and floss, you're saving yourself a lifetime of problems. So make sure you are flossing your teeth. And since we're on the brushing and the flossing, what happens when you don't floss is, I'll show it this way. So tartar builds up in between the teeth, just like that. Whoops, let me go. Which way? I think it's this way. Can you see it? Maybe not.
Over to the left.
Over to the left. There we go. So, but anyways, it builds up in between the teeth and it stays, and it's soft at first and then it hardens on the teeth. So it'll stay there for years and it keeps growing down in between the gums. And then the hygienist and the dentist, we have to basically take special instruments, and then we have to go in. First, if we can't hand scale it off, then we have to use special rotary instruments to actually take it off. So, and then that
try to avoid that.
Yeah, that's what we want to avoid at all costs, because then you have to come in, we have to get the areas numb with anesthetic, and then it's a little bit more work for everyone. So, so then also the next area to cleanse the mouth. And since the pandemic, since everybody couldn't go to the dentist could only see patients on an emergency basis. And so they only saw their own patients. They didn't take in new patients. So they only saw patients of their own. So they made sure that you were an active patient. So they didn't bring in anybody outside of that. I was getting calls that people had toothaches, and I've been retired for 4 years. And I had people calling me saying, "Hey, can you see me? Can you have your dentist, see me?" And they couldn't. And so I was telling them what to do at home. Most dentists was writing prescriptions, asking them questions, sending them to emergency rooms. So, and they had terrible toothaches. So the next thing you want to do is get a tongue scraper. And the tongue scraper is a key. It removes bacteria from the tongue. The tongue is one of the largest organs in the body. It harbors bacteria and holds on to it forever. That's where halitosis begins. And so you want to make sure that you are taking that tongue scraper and actually, if I can get back up here again, going to the very back of the tongue, and scraping down toward and out of the mouth. Now, you're going to have to control your tongue and really forcing it to stick out and scraping at all angles. And then on the side, scrape it, and also the tip of it. And you'll start to see little fragments come off on the tongue scraper. So, and every toothbrush on the back, they have like little ridges. I don't have one that's open, but it has on the back now has little ridges, and it's known as a tongue scraper. So take a look at your toothbrush next time. If it's a good one by Crest, Oral-B, they have tongue scrapers on them. So use it.
Okay.
Yes. Now
we probably thought it was something like, we probably thought it was just a design or something. Yeah, that it didn't have any practical use.
A lot of people do, and we tell them that, look at your tongue scraper. I mean, look at your toothbrush because it's right on there.
Mhm.
But they do make them. I mean, you can get them at the dollar store, if you want. Dollar store has everything, so you can get them there.
I agree with that.
But they make them all kind. They make them fancy. Go ahead.
Hey, Gail, someone did ask in the chat, and I normally don't do this early, but it's a good question. It's related to what you're doing, and that is, are water flossers okay to use?
Yes, I was going to cover that. Water flossers are really good to use, especially if you have braces. If you have spaces, big wide open spaces, like here, if you have like big wide open spaces in the mouth, here on the sides of the teeth and the front of the teeth, the removed debris that you obviously see, yes, they are.
Mhm.
And they're inexpensive. You can get one for $20, and they work just as well. So yes, but we still recommend that you get out the good old floss to floss your teeth. So don't be afraid. You got to get in there with the floss. This is the best source to saving your teeth is dental floss. So make sure that you do floss your teeth with regular floss at least once a week. But I'm talking about use other things to floss, but use regular dental floss to floss.
Gotcha.
Because that floss is made to go right underneath the gum tissue perfectly. Yeah.
Excellent.
So, yes.
Okay. Sorry to interrupt. You just keep going.
No, that's fine. Our next source is mouth rinse. Now in the dental office, due to COVID, ADA has approved for, we used to use Listerine just to have our patients rinse out before we treated them. But now they're having everyone to use iodine rinse and water. It's already formulated. It's just like a little less than 1% iodine, and the rest is water. And it is already formulated. And this is what it looks like. I better fill it up so you can see it. That's what it looks like.
Okay.
This is new.
Looks like
it's only been. It does. But it doesn't taste like apple cider vinegar, and it doesn't smell like apple cider vinegar. And let me tell you, cheers. But it's only been out for about the last couple months. So, and this is dentists can get it. So it's only it's formulated for them. You can go on Amazon. I saw a couple different ones. So the taste is not that great. So if you don't like that, I would recommend Listerine and peroxide. It will do the same thing. And it's kind of like a 50-50, and you can already have it made up in your home. It's like a squirt or two of Listerine, and then it's a mixture. It's a mixture of peroxide. And voila, you got your nice little cocktail, and you just swish it, and there you have it.
Nice.
But the gum, the tongue, the whole bacteria, it comes out of your mouth. And we're talking bacteria that's under the tongue, top of the tongue, and down in the vestibules that you need to be removing. So that's what they're recommending. Your dentist is going to have you swish with it. If they're not, they need to step up their protocol. And, it helps with this once you've had COVID and all those good things. So it removes bacteria. So they need to step it up.
What was the name? What was the name of the product before? Just one more time.
This is an iodine rinse.
Iodine rinse.
It's an iodine rinse. Now, don't go out and buy a bottle of iodine at the store. I mean, you could, but it's only just like a tiny drop with water. But get the one that's formulated for dental approval online on
Excellent.
Amazon, and it works great.
Great.
Now,
Great information.
and if you have gum disease, and we send you out to the specialist, and I'm going to give Dr. Sakamoto, who is on the north side and the east side office. He's a gum specialist. I worked with him for 30 years. He does implants as well. So if you're missing teeth, go see Dr. Fred Sakamoto. There's another rinse, and then most general dentists use it. It's called chlorhexidine. It's also another good product that is good for gum disease, that helps with gum tissue and bacteria in the mouth as well. So that it's another good one. And the doctors would write that prescription for you to get. So this is another good one. But Listerine is the best one on the market for you to use. You can take a shower in Listerine, and it strips any bacteria on the body. So you can shampoo your hair in Listerine. The original Listerine is the best. The other ones are a little more fancy now, and a little more decorative. So I recommend Listerine products every day.
If my children are watching, they're probably saying, wow, mom's been saying that for years. Now they're going to try to use it.
Right.
Yeah, I agree. Listerine is definitely the product.
Right. Our next thing is cancer screenings in the office. We have a device called the Veil Scope, and the Veil Scope is used when you come in to get your initial exams, and we do it once a year. So the doctor will use this when he does his exams to make sure there's no cancer spots in the mouth. When you see patients who smoke, you may have some kind of normal cells that appear in the mouth, and so we check that for you. The dentist also will check. We check at all blood pressures. We take blood pressures. I got a blood pressure cuff that we normally take blood pressures on every patient. We check a lot of medical issues. We do CPR on patients. We do CPR. We certified. We have to be licensed and certified in CPR. And blood pressures, cancer screenings, you name it, we do it. We're just like a medical staff, just like any other medical practice. So once you start taking care of patient care, we have to do the same thing. Because
like I said at the beginning, well, I was going to say, like I said at the beginning, what happens in your mouth can affect or be affected by what's going on in your body.
Right. If you have high blood pressure coming into the dental office, we can't treat you. So just know if your blood pressure is sky high, we can't treat you. We have to send you either to the emergency room, or we send you, tell you to contact your doctor, your medical doctor. So.
Good.
And then a lot of patients, they used to use baking soda, and baking soda can be very coarse on your teeth. And yeah, it helps heal the gum tissue, but it can cause problems when you're brushing your teeth. So, it's good for the refrigerator, but don't use it on your teeth.
Well, that's old school. Our grandmothers but that's good to know. That's good to know.
Yeah. And I'll tell you another one. If you have pain, don't put an aspirin on your gums, because it will burn your gum tissue. Call the doctor. Call the dentist. Call the dentist. And then another part I was going to mention is we're going to talk about healthy teeth. Healthy teeth should be white. I had to draw some teeth out here. So healthy teeth should be white. Your fillings now should all be white when you go to the dentist. Have them, if you get a cavity, they should be white. And teeth are meant to be white. A lot of people get like the silver fillings, but the silver fillings contain mercury, and they need to all be removed if you have mercury, because they're finding that they can leak and cause harm to the body. So we want to make sure that you getting those removed and replace those with the white. And that's what I did. I filled the teeth, and so make sure they're white and not silver. And stop having dentists remove your teeth. You want to try to remain and keep all the teeth in your mouth, because when you get 30, 40, 50, you'll start to lose your bone structure, and then you get the lip and the nose, chin kind of compressed together, and then you won't have ability to chew your food. They won't be able to put implants in if they need to. We won't be able to make dentures for you if we need to. So you need to keep all the teeth that you can. And then patients send a call when they get to this point. And this point is when you're in pain. So what happens when you're in pain, you get a cavity, and the cavity or decay eats at the enamel of the tooth. Cavity bugs tend to form, and they eat all along at the tooth. You won't get pain maybe for about 3 to 4 months later. Then all the infection starts to drain down into the canal of the tooth. And when that happens, the tooth starts to do its own root canal. Then the canal dies. It all pulls down here to the root of the tooth. Then it becomes necrotic. The tooth tends to leak, but it leaks down into your blood system. So when that happens, it can go down and into your heart, so causing cardiovascular issues, and that can be really bad. So some people have like 4 and 5 decayed teeth that happens to, and then you got some major problems. So when that happens, it may be too late for us to even try to treat you, and then you need to either go see your doctor to try to get the infection out of your body, and cardiovascular and the infection in your body like that, it can be really bad. So
or even fatal.
It could be very fatal, and I've seen it happen before as well. So teeth are very important. Keeping your immune system healthy, eating right, fresh fruits, vegetables, green leafy foods, very important. So stay on top of it, because it all plays a part. Your food or your teeth are the first thing to digestion. So stay healthy. And that's the basis of healthy teeth. The next thing I want to talk about real quick is the whitening and Botox. And then I think that pretty much will cover it. So with whitening, we have Zoom in the office, home trays that you can get. And Tray White is one of the leading products, like $75 at Dr. Nicola Raptu's office. He has Zoom in office, and that's the one that we do for an hour. You walk out and your teeth are white. He also makes custom trays with that so that you can take them home. And then if you have a special occasion, then you can pop your trays in at home, and it takes about an hour, 45 minutes to an hour, and then your teeth are white. So that's the upkeep on the Zoom whitening. This is about 10 to 14 days that you have to do at home for $75. Now, the in-store products, it's less concentrated, and they just keep you buying it over and over and over. The other stuff on the internet it's essential oils, but it won't last. And what happens is it keeps your teeth stained. Like it'll look white, but then the next thing you eat something and then your teeth are stained again. So I wouldn't recommend it. If it's not American Dental Association approved, I wouldn't use it. Because a lot of times, like I said, you gotta be careful what's gonna hurt your enamel. So other than that, oh, and then braces real quick, Invisalign. A lot of people have heard probably about Invisalign. And these are the little trays that we use. We take the impression and they tell us how long it's going to be, and they're pretty firm, and we give you about 4 weeks worth, and you take them home, you put them in, keep changing them in and out. We bring you back, we give you a couple more, and voila, you'll have nice, beautiful, straight teeth. Just like that.
And how long does that take?
It just depends how what they say. Like some people can maybe 10 weeks, some 22 weeks. You know, it just depends. Just about how things look. So
it's nice. Well, it's better than all the metal.
Oh yeah, yeah. Because I had metal, and so things have changed in my 30 years of dentistry. So yeah, so it's all good.
Excellent. Oh, great. Well, you've got lots of questions in the chat. I mean, a lot of people have questions. So we're going to fire away. But before I start with the question, I want to say that Linda Lewis said, "Good evening. I've never saw a dentist or dental assistant look that good." Go ahead, sister.
Oh. Thank you, Linda.
So wonderful. So anyway, let's start with the first question. And of course, you just spoke about it a second ago, and that is whitening. Are there whitening strips that are, they asked if they're good for you. Are there some that are not so good for you? Is my question, I guess. Is there a downside to whitening strips?
Well, we recommend that you leave them in only for the recommended time. And that's some are now half hours to an hour. And at that time, take them out and then brush your teeth, rinse your mouth. And if you feel like there's still some material on your teeth, take a washcloth and wipe that off, brush your teeth again. Swallow any residue that is remaining. Spit it in the sink once you form those on your teeth, and spit the residue in the sink. Don't swallow any of the product. Pregnant, anybody that's pregnant should ask their physician before using the product. 12 and under should not be whitening their teeth. Should not be.
Yeah. Okay, just got my teeth cleaned today. What is the value of adding fluoride applications twice or 4 times a year?
Fluoride is a protector for the teeth. So if you are cavity prone or you're not brushing twice a day, kids, excellent. There's a whole lot of myth out there about fluoride. We used to get fluoride in schools. I don't know if a lot of you remember or not, but they used to bring it to the schools because it wasn't in a lot of folks' water. I grew up in Kentucky. They used to bring it to school and we line up, and it was like an assembly show. We used to go get it and swish around, and we had fun doing it. But I would recommend it. We still do it at offices. So it's a foam now, and there are different flavors. So if your dentist offers it, I'd get it. It's all our preventive measures. If your parents, it's going to save you money in the long run for your children. They leave it on for 30 seconds, just protect your children's teeth. It's always good after cleaning. So do it.
Okay, great.
You're not swallowing it. You're not. So.
Yeah, don't swallow it. Yeah.
Yeah.
So another question is, what is considered high blood pressure that you would refuse treatment?
If it's 130 over 90 to 100, the bottom number over 100, we have to start looking at what your medical history is with that. We give you anesthesia and anesthetics and stuff, so we have to be very careful. Your adrenaline and all can raise blood pressure more, so we have to be very careful.
Okay.
And if you're on blood pressure medication, we have to see what you're taking and how much and how many pills and what else with that.
And that's why it's so important to share that information up front. Don't, be honest and
be honest. We ask you your medical history every time you come in. So we take your temperature. The stuff that they're doing for COVID, we've done that forever. So it's nothing new. Masks, gloves, shields, all this stuff. We do it. I mean, we use a barrier to do fillings, and that's the rubber dam. Everybody's known about the rubber dam, but we do use that. So it, I would just say, just it's all of preventive measures. So this
absolutely.
Yeah.
All right, next question. What age should you start taking children to the dentist?
They've kind of changed it. We don't see them until they're 3 years old. We ask that you bring your child in with you at your visit when they turn around 2.5, just so that they can get a chair ride and see what a dentist is all about and have fun. And then they get kind of used to it. Now they're starting to see kids at 1.5 to 2 years old at some of the offices. That's fine too, but most of the time kids don't have their teeth till about, well, some are born with them, but you can take a washcloth when you first see the first tooth, you can take a washcloth and wash their gums, wash the first tooth with a washcloth. And you gotta be careful, kids will bite you. I've been clamped down on so many times that it's pretty painful. But around 2, 2.5, 3. But we see them at 3. We see them. And parents, please do not send your kids to bed with a bottle. Give them water. Give them water. If I can't say anything else, give them water. They will be fine. And we have seen so much. Well, I must say, I had a neighbor that had that. Their child had a lot of decay, and you have to send them to the specialist to be treated.
Early on. Wow.
Early on, yeah, because we deal a lot with adults, so I must say.
Okay. Next question is, how do you keep veneers white?
Well, you can't, once you get veneers, you can't change the color. Crowns veneers the color is the color, so you can't change the color. There's no whitening, no nothing. So other than they will kind of stain if you drink a lot of tea, a lot of coffee. You go to the dentist and you get them polished off with polisher. So other than that, there's nothing you can put on them.
All right.
Now, porcelain, they keep changing porcelain every year in dentistry, just about, with shades. So if you've had old dental work done years ago, 10, 15 years ago, the colors have changed and they're better. They're beautiful. They look so natural now. It's not a thick porcelain, it's more tooth-like.
Okay.
Natural tooth-like.
Nice. Right. Not too white, not too.
Yeah.
They look natural. That's awesome. Okay. Can you get braces at any age?
Um, you when you're young, when you're a child, they do it in two phases now. So they do it at adolescence. They do it younger, maybe from like, oh gosh, I don't forget most of the ages now, but more so like it around right before the middle school time frame, and then again maybe around teenage 15, 16 year olds. You can
Mm-hmm.
get braces as late as 60, 70 year olds if you have all your teeth. And then you
Mm-hmm.
can get braces if you're missing teeth and you're going to have implants.
Mm.
Yeah.
Okay.
If you're missing
Mm-hmm.
teeth and you need some correction, you can get braces. So, yes to your answer at any age.
This is a good question coming up here, and it has to do with what you talked about early on in this discussion, and that is why do they make hard and soft toothbrushes if they're not best to use? I'm surprised at that too. I've heard that you should always use a soft brush. So when you confirmed that, I was happy to hear that. But at the same time, it's like sometimes you go to the store and there are only hard brushes.
Well, you have different manufacturers that make these toothbrushes. So
Mm-hmm.
Oral-B and Crest, they make soft toothbrushes. These are all Colgate, Oral-B, Crest that I have here, and they make soft. Um, you have all the other manufacturers from different places. They will make medium to hard, so that they can get a sale from from customers, because there's customers who
Mm-hmm.
want medium and hard. They
Right.
don't care about
Or they just don't know any better. So
no, they don't care about
right,
your teeth.
right.
Yeah,
Yeah, yeah.
yeah.
If they think they can sell it to you, they will.
Oh,
Mm-hmm.
they will. Yeah. Well,
Mm-hmm. Interesting.
so
Um, This is a good question. And, I always say this in a lot of other episodes of Wellness Wednesdays that it always comes back to your leafy greens and what you eat and what you put into your body. But someone
mhm.
is asking, are there some foods you should be careful eating to avoid damage to your teeth, like almonds, since they are so hard?
Yes, yes. Almonds is the biggest culprit, one of the biggest culprit that we see that will crack a tooth. It will split a
Mm,
tooth right in half. And then that's when
really?
it gets down here to the pulp, and it will split it right into all the way down to where the tooth is just like this. And you can lose the tooth or you have to have a root canal.
Wow.
Yeah.
Wow.
Um,
I didn't know that.
Caramel apples, anything real sticky tacky. Some of these candies out here, that's the worst nightmare if you have dental work done, like crowns, bridges, it will pull them right off. Um, Anything that's super hard, crunchy. I just got a call right before the segment. One of our young patients, he's in New York, and he broke his front tooth, and his
Mm.
he was a patient. He's a patient of ours, but he's out of town, so he knows a lot of them have my personal number, and they know they can call me and say, "Hey, can you call Dr. Rapp too?" And call him and let him know. They some still think I work there. Some know I have a connection to him that I can call and get him in. So
Mhm,
yeah.
mhm.
So
Wow. Now, I didn't know that about almonds. Wow. That
almonds are,
yeah, because that's not the most soft nut, that's for sure.
and
Yeah,
anything
not at
frozen. Some people freeze candy bars and they go right
all.
to it.
Mm,
Ice is the worst. Ice, chewing ice on
mhm.
ice. You can't heat up a tooth. I mean, like ice is cold. So when you
Right.
put something so cold on a tooth and into a warm mouth, that will cause the tooth to kind of expand and contract, and you get these
Mhm.
little cracks in your enamel. and that will do the same thing.
Mm,
Hmm.
amazing, amazing. Another question was, do you suggest electric toothbrushes, and if so, which one? And I know
Sonicare.
that I've seen so many different ones. Some have square, some have round, you know.
Well, my boss would tell you I'm not a big fan of them because I have some dental work myself. But Sonicare is good. A round tip is better, like this.
Mhm,
Square, your mouth is not square back here, so anything that's
mhm,
better to get back to the back. So if you're
mhm.
going to use, I always think electric toothbrush, I would follow up too with a regular brush because you can't
No.
hardly maneuver around the backside of a tooth. Like you can't get to the backside of here. Like on, oh gosh, I can't get in the camera, but like around the,
Too
I can see, I can see it on my second camera,
late.
like on the backside of a tooth. You can't,
Uh-huh. Uh-huh.
your jaw is only going to open so far. So, I would recommend
Mhm.
following up at least once a day with a regular toothbrush.
Mhm.
So,
Good point. Good
yeah.
point.
But there's
Excellent.
Crest, there's Oral B. They have so many now out on the market. Um, but Sonicare is what we would go to seminars and learn about and recommend.
So, let's go back to the infections
Yes,
and how
yes.
that, yeah, and how that impacts the body from the tooth.
Okay. Let me show you here. Just say for instance, when you get an infection, and this is your gum, most of the time you're not even aware of it, but say you have a filling right here on this back tooth, and you crack that back tooth, and you start getting all this leakage inside from eating certain things,
Mhm.
candies, and you don't brush at night, and you might go a week without brushing or a month without brushing your teeth, and all
Oh,
of a sudden you say, oh, this hurts, and I've got this bump on the side of my tooth. Then all of a sudden you got this big swelling outside of your jaw. Well, you come in to see the dentist, and we take a look around, and he looks, and we see this big knot on the side of your gum. So all of a sudden, this right here is the infection, and it's coming from the inside right here. Hold on 1 minute. It's coming from the root of the tooth.
mm-hmm.
And so that has all that infection has collected in one area. So now it's coming outside of the jaw, right here. It's coming outside of the jaw on its own root canal. So
Mm-hmm.
now it has nowhere else to go, and we have to now go in and do a root canal. But with
Gotcha.
other patients come in like this, the filling has cracked. I've also seen them come in like this here on the top of the tooth, and where we have to drain it. And most of the time, you have to drain it,
Mhm.
put a person on an antibiotic, and so that the infection doesn't continue. So, like I
Gotcha.
said before, it can lead, in fact, if you think the tooth has a root, and on upper teeth, I mean, it's your sinuses is right here, and
Mm-hmm.
then all this is your eye, and then it's connected to the brain. So infection
Mm-hmm.
can lead right up into the brain, and
Mm-hmm.
that's fatal too. And then
Mm-hmm.
infection into your heart leads to the heart, which can be fatal as well. So it can
Gotcha.
cardiovascular, and I think you guys have had cardiovascular doctors on before, and has
Mm-hmm.
probably talked about that as well.
Yeah.
So
So what
you don't have,
last week we talked about diabetes. And
Mm-hmm.
so, what's the relationship as far as your dental health and diabetes?
Well, if you're diabetic, you have a hard time healing. So, like
Mm-hmm.
if you're missing teeth, if you need dental implants, you have to. It's hard to heal. That's the
Mm-hmm.
number one thing. It's really hard to heal. So, chances are you might be your blood sugar might be at a level to where um, we can't do too much. I
Mm-hmm.
mean, we
Gotcha.
feel your
Gotcha.
clean your teeth, but we may not be able to do much more than that. So,
Gotcha.
but like I said, we
Mhm.
may have to send you to a gum specialist. Now they tend to do a little bit more,
Mhm.
but limits of your diabetes.
Right.
So,
So
yeah,
speaking of gum specialists, what is gingivitis?
gum disease.
Okay.
Gingivitis
Okay.
is inflammation of the gums, so it's gum disease. It's the same.
Mhm.
And gingivitis, that we do measurements of the gums, and if you we use a probe, and the probe measures how deep pockets in the mouth are. So like
Mhm.
1 and 2 and 3 is very healthy. Anything
Okay.
past 3, and it goes all the way up to 10, and if
Mhm.
you're 4, 5, and 6, we can get you back within reason to good gum health.
Mhm.
But anything past that, well, you're gonna have to have treatment with the specialist, gum specialist.
Mhm.
But you might have to have surgery. But if not, you may lose the teeth because the bone.
Mm.
That means the bone can't hold those teeth any longer.
Mhm.
So lose it. You might lose wherever it's at. You may lose the teeth because
Mm.
the bone down in here is just gone.
Mhm.
So
Mhm.
yeah,
But if you
the treat.
catch it early, if you catch it early enough, is it something that can be reversible?
Yes, we bring you in, and you get what's called deep cleanings. That's
Mhm.
that's what we can do, deep cleaning. Now it's a little bit more involved than your regular cleaning. You might have to come in 3 times a year or 4 in order to
Mhm.
maintain your gum and bone
Mhm.
health. The bone
Mhm.
is
Mhm.
really important. That's the reason why I say you have to, be in there flossing every day,
Sure.
every day.
Mhm.
Like I said, if you miss
Mhm.
brushing, okay. Flossing, you cannot miss your flossing
Hmm.
at all. When
Interesting.
you get when you get 20 years old and older, you need to be flossing every day. And I show this
Got it.
because men have a hard time flossing because their fingers are so big. So they have
Mhm.
to use different devices in order to floss. This is a flosser, so like I said, they have to use special little
Oh,
equipment here, little flossers to get down in between their teeth. Women too. I
sure.
mean, I have
Mhm.
these. I have these little plaque, and you've probably seen them. Everybody's seen them everywhere. That where you can just
Mhm.
buy these and use them in between your teeth. And like I said, flossing is the key. That's the only thing that's going to save your teeth. Now we
Wow.
want you to brush, but flossing is key.
Okay, so we have a couple more questions and then we're gonna wrap up. So,
Okay.
one is my brushing technique, I think, may be causing my gums to recede a little. Can you explain briefly again, if you have not, the proper angle you should use when brushing teeth? And what angle do I hold the toothbrush to my gums and teeth when brushing?
Yes, it's a 45-degree angle that you should be using. And if it's your upper teeth, you brush the teeth. It's always away from if it's top or bottom. So if it's 45-degree angle, you're brushing coming down. And if it's the lowers, you're brushing coming up.
Mm-hmm.
I don't know.
Mm-hmm.
I'm working backwards. So, and then for your surfaces, it's like a little scrubbing motion, but it's all gentle because you're using a soft bristle brush and brushing away from the surface. And then here on the inside, up and out.
Great, great.
Yeah.
All right. And then last question here is, my insurance changed. I need a new dentist in the North End area. Have not seen one since before the pandemic. And I think we talked about that a little bit. You really couldn't go in and see your dentist regularly and get your cleaning and all that stuff during the pandemic. So a lot of people are in this situation. What should you do at this point? And I hope that, this is the window. Hopefully we're not going back to where we were March 2020 with this Delta variant and all the other things that are happening. So
What's happening right now? So people, if you need to see your medical doctor, your dentist, mammograms, you need to go now. Within the next month here, this next 3 weeks, you need to be out and seeing these doctors right now. Numbers are increasing. I know Governor DeWine came on yesterday, and he's being pressed here in the next few weeks that he's going to have to eventually, because kids are back to school, so things are changing.
Sure.
I would highly recommend that folks, you should already now be on your second appointment to get your teeth cleaned. Last year, people got caught and couldn't go see the dentist. So, it'd be a whole year. So you should be there. You should almost be pushing a third cleaning in if you think that you've got issues. If you need dental work, get the dental work done. If your dentist recommends something, get it done now. Because dentists were almost the last ones that got shut down. They were almost one of the last that got shut down. So go now, get your teeth clean. Go now and get your teeth clean. That's all I can say, because it will happen. It will happen. So
Excellent.
And
Advice.
and there is some things that you can call. So your emergency room you can go to, or emergency numbers that you can call. I know dental clinic used to take those calls. Like I said, I've been retired 40 years now, so I'm not 100%, but it's worth a try to call them to see if they would take, emergency call just to let you know. So.
Gotcha. Excellent.
But always
Well,
call
this has
Dr.
been. Oh, say it again. Say it again.
I always call Dr. Nicholas Rapp too. He can help you in Worthington. He's in Worthington, so you can call there.
Well, that's North End, so that's perfect. That's perfect.
North End. Yeah.
Excellent. All right. So, this has been, wow, just some really great discussion here, great information. Some of the things that we thought we were doing right, you helped us understand that we need to do more relative to our dental hygiene. So this has been great. Do you want to follow up with some final words here?
I thank New Salem for giving me a call, and Sister Brenda Troy for giving me a call and being on Wellness Wednesday. And this is my passion, so love it. But if anybody has any questions, they can always directly inbox me, and I can help them out further.
Oh, wonderful, wonderful. And I just have to remind everyone, as I always say, with every discussion, whether it's your teeth or your heart or anywhere else, we always come back to eating your leafy greens and eating right. I mean, it just makes such a huge difference. It really does, for your entire health. So thank you so much, Gail, for joining us. This has been a wonderful, wonderful episode. I love all your demos and your displays and all the great gadgets you got there, and that really helped tell the story. So I really appreciate you pulling that together. Thank you so much for sharing your knowledge.
Thank you so
And
much.
awesome, awesome. Thank you all for joining us tonight. Appreciate that you're here. Again, stay safe and stay healthy. Have a good week.